Welcome back to NYSE TV Live, everyone. I'm Kristen Scholler here in studio at the Stock Exchange. Well, the American Academy of Sleep Medicine has been studying better sleep practices for nearly 50 years. And I want to send things over now to my colleague Trinity Chavez with more. Hi, Trinity.
Hey, Kristen. Yeah, so there are so many factors that contribute to sleep apnea, including chronic obstructive pulmonary disease, or COPD, which many people know it as, which is also another major area of focus for ResMed. And according to the CDC, nearly 16 million U.S. adults have COPD, and many more don't even know that they have it. So COPD rates in the U.S. remain steady over the last decade, with 1 in every 17 adults affected in 2021. Unemployed adults were twice as likely to report COPD compared to those unemployed. Additionally, 1 in every 5 adults were unable to work had the condition, down from 10 years ago. Meantime, regarding sleep apnea, the American Academy of Sleep Medicine is performing a CDC-funded obstructive sleep apnea awareness project as a part of CDC's Chronic Disease Education and Awareness Program. Joining me now to talk more about it is Dr. James Rowley. Good morning, doctor.
Good morning.
Yeah, so can you tell me a little bit more about this CDC-backed study?
Yes, we've been participating in a study that has both presented data, gathered together a lot of data about sleep apnea in the United States, and then we've been using resources to get the word out to both the public and primary care physicians about how common sleep apnea actually is in the United States, and what associated disorders.
Yes, sleep apnea affects about 20% of the population, actually. So what do you think are the key risk factors contributing to this high prevalence?
Probably the biggest one is obesity.
Yeah.
Sleep apnea is definitely an obesity-driven disease. The more you weigh, the more likely you are to snore, and the more likely you are to have sleep apnea. And as we know, obesity is a major problem in the United States at this time.
Yeah, and with an estimated 39 million U.S. adults suffering from obstructive sleep apnea, how does this condition impact daily productivity and the broader economy?
Yeah, so sleep apnea prevents you from getting a good night's sleep. So for the average patient with sleep apnea, they can be sleepy during the day, not have good focus, not be able to concentrate at work. There's definitely known increased risk of accidents at work and while driving with sleep apnea. It is also it's been shown that sleep apnea is associated with increased medical visits, doctor visits, emergency room visits. So that's definitely another way it impacts the U.S.
And this condition is often underdiagnosed. So what are the signs that people should watch for, and why is this so frequently overlooked?
Because snoring is the most important symptom, and I think there's just a general society feeling that snoring is just something to sort of laugh at and not be serious about. But loud snoring is definitely a symptom of sleep apnea, and should be evaluated if it's something that is particularly bothersome to a bed partner or a loved one. Mm-hmm. Other major things are if you see your loved one choking or gasping at night, and then having daytime sleepiness, fatigue, inability to concentrate, are all reasons to be evaluated by a sleep doctor.
Doctor, briefly, what are some of the potential long-term complications of untreated sleep apnea?
So there's clear associations primarily with cardiovascular disease, definitely higher risk of high blood pressure, heart disease, whether you think of it as coronary artery disease or congestive heart failure, also increased risk of stroke. There's also some evidence of increased risk of diabetes as well.